Bruising, the most common side effect associated with any fillers, especially when they're injected into the skin, and that's the subject of today's topic. Our faces are so sensitive and the skin is so thin. So bruising is a perfectly normal response to injections of any kind. And we always stress to our clients that they should be not concerned if they do bruise a bit. Bear in mind that when Belotero Revive is done, it is 16 to 18 injection points on each side. So you've sadly got put in two sides. Nasolabials and marionette lines have 2 insertion points, and so it's the same with the marionette. So generally a bruise would last 3 to 5 days, but we usually let clients know that if you are a bruiser, that it could take up to 2 weeks for bruising to subside. And any swelling associated with the filler as well, because as soon as we inject the hyaluronic acid, it starts to attract water. During and after treatment, we have handed our client a ice pack that they place up to the face before we do the injection, so that makes it more comfortable for them. We also encourage them to keep it up when the treatment is complete, and that will help to constrict the blood vessels and slow the flow of blood at the injection site, and therefore the incidence of a bruise from an injection is reduced. So some people might get 1 or 2, maybe even 3 little bruises, but at least you're not getting 20. Or some people actually can be quite vascular around here, that they could find that now is the time, which is a great time to wear the masks, that you can actually, if you're going out, you can put on your mask and nobody will notice. To be honest, nobody notices anyway, and after 24 hours you can apply a concealer. I'll show you. So here's the concealer that I use. It's from Maybelline. It's called Concealer Eraser. You take off the top and there's a little sponge on top of it, and you just twist up the product and it actually comes to the top here. Now I have a little bit too much on there, but and I usually just dot it onto the area that has the bruise and blend it in. Now this is the most inexpensive one. I tend to use that sometimes especially around my lip area if my lipstick is bleeding before I put on my lipstick, but it blends in quite well and it'll hide your bruise. And I wear it when I inject myself. So if I've done injectables on myself and I do have a bruise, I tend to wear this. And nobody's ever made a comment, or either they're just too polite or they're too busy getting on with their own lives. But a Dermablend from Vichy is probably, I put it here, is probably better. And the concealer from Maybelline is probably a little bit more creamy, whereas this one is actually quite powdery, which suits me. But anyway, so if you're looking for a good concealer, probably the Vichy one, Dermablend, is probably the better one. But bruising is more common after a filler than it is not. Some studies suggest that only 19 to 24% of patients would actually get a bruise from an injection point. But others have concluded that the figure is as high as 68%. So if you are an arnica lover, either the pilules or the arnica cream, you can use both. Some people would use the arnica pilules before the treatment and continue it for 24 hours after the treatment is done. And other people then wait to see if they do bruise, and then they would use the arnica cream on that particular area. If you're a believer in it, great, it works. Not only are you at a risk from the fillers, which is the Belotero volume that we put in here and here and here and here, but even with Belotero Revive, we actually glide the needle at a 10-degree angle just under the skin. You're not without risk of getting a bruise either, because our little blood vessels, what they're doing is bringing blood and nutrients and oxygen to all the cells that you have in your body. So even though our needle is very tiny, you might avoid it when you're actually inserting the product, but on the way in to insert it, you could just burst a tiny blood vessel. And obviously what's going to happen is that you're going to bleed under the skin, and that is what relates to the bruise. So we have any client that comes to us, we give them our WhatsApp number, and email, and we are on hand. The worst thing is for you to be at home freaking alone and asking your friends to know what they think, which is the worst. And we encourage anybody who is bothered by the bruise and how long it's going to last, and if they just need reassurance, we would far prefer that you call us or even send us photographs, or if you're living close by, to pop in so that we can check it. Do not, under any circumstances, chat about it to people who know nothing about the work, who haven't administered the work, who don't know anything about the work, and have their own opinion on, what they think. What do they know? Firstly, and secondly, you need to get in touch with the person who did the job in the first place. Usually there isn't a problem. I think it's very nice for you to know that you have the option to be able to reach out to us. But usually if you're well prepared that it's going to happen and you just ride it out and trust the process, we know that you will be very happy, and in 2 weeks it settles beautifully. And others, the likes of Sherna, for example, I injected her face just before Christmas, and she said she had a little bruise the following day. So that was Christmas Day, and 2 days later then it had totally dissipated. So some people get a very, very tiny bruise and it's barely detectable. And the concealer, what have I done with it? The concealer is very handy to be able to conceal it. But so here's a photograph of somebody who actually got quite a big bruise up here. It was an injection of filler into the cheekbone here, and beautifully covered, and went to work with concealer. So sit tight, let the hyaluronic acid settle into the tissue and do its work, and that bruising is the most common side effect associated with fillers. A little bit of swelling too, particularly to our sensitive skin, but you got to know that it happens. And others, the likes of Sherna, for example, I injected her face just before Christmas, and she said she had a little bruise the following day. So that was Christmas Day, and 2 days later then it had totally dissipated. So some people get a very, very tiny bruise and it's barely detectable. And the concealer, what have I done with it? The concealer is very handy to be able to conceal it. But so here's a photograph of somebody who actually got quite a big bruise up here. It was an injection of filler into the cheekbone here, and beautifully covered, and went to work with concealer. So sit tight, let the hyaluronic acid settle into the tissue and do its work, and that bruising is the most common side effect associated with fillers. A little bit of swelling too, particularly to our sensitive skin, but you got to know that it happens. And can you imagine the state if you had of your face, if you had a facelift, or an eye bag removal, or a blepharoplasty, or a neck lift, or whatever, the swelling doesn't go down for nearly a month or 6 weeks, and the bruising is usually something that you would have had to go into hiding for. So yeah, there you go. I hope that helps. Bruising is the most common side effect associated with fillers and injectable moisturisers, the likes of Bellaterra or Revive. So it's a small side effect for the wonderful result that you get, and it's only twice a year. I hope that helps. Bye.